How low are we going? We're going low. My name is Tamara Green, pelvic physical therapist. Welcome to Below the Skirt with Tamara, and I help women overcome uncontrolled bladders, return to that pleasurable sex, manage those pregnancy symptoms so you can become a postpartum champion. And it is October, and it is Breast Cancer Awareness Month, and we have a special guest. We have a survivor, a strong woman. We have Karla Mironov of Karla Jean Studio. Hey, Karla.
Hey, Tamara, how are you?
Good. How are you doing?
I'm good, thank you.
Thank you for coming to share your story as it is Breast Cancer Awareness Month. Thank you for sharing your story and just wanting to know how we're going to tie this all together in reference to breast cancer treatments and then how physical therapy ties in. But before we can really get into that, we really need to talk as we speak to the women out there. Explain what if you could tell us your story. How were you diagnosed? How did you begin this journey of breast dealing with breast cancer? How were you diagnosed?
Well, I was working out, exercising, trying to get fit to go on a trip to Italy, and you know how you do that when you are traveling. You want to be strong and look good too. And I had lost some inches, and I noticed that my breast tissue was indented. And
Mm.
I thought, well, that's really inconvenient. You know, you're losing weight, you want to look better, not like bumpy, lumpy. But after a few months, when it didn't go away, I went and had it checked out, and it was indeed cancer.
Gotcha. So, and that's interesting, Carla. And thank you for everyone that's tuning in and those who will catch the replay at another time. But, a lot of times they say, hey, either you check for a lump or possibly if you notice any drainage is coming out of the nipple region, but yours was an indentation.
Yeah, so I was very lucky that I was being seen by a very attentive chiropractor who's become a very dear friend of mine, Carrie Stone. And I mentioned it to her, and she was like, "Yeah, you probably should get that checked out." Um, and and then I ended up going to the OBGYN, and she just kept referring me down the line. But it's where the cancer had retracted and retracted the skin. It was drawing the skin in. So
Okay. Wow. Was
I'm
it
glad I got
painful?
checked out. Yeah.
Was it painful at the same time besides the indentation?
No, no,
Okay.
there was no pain.
And this is a big component because a lot of times, we hear, either check for a lump, check for drainage. If it's a painful area, yours was not a lump, yours was not drainage, yours was an indentation with no pain. What
Yeah.
stage was yours?
I think it was 2A or something like that. They
Okay,
don't really talk about the stage very much. You know, they
gotcha,
kind of give you an initial assessment and then more and more diagnoses as information keeps coming in. You know,
gotcha.
it changes by the day.
Gotcha. And what was your what? And I'm sure just going through that, and as you know, this is so important because there is some woman that may say, "Hey, I'm going through this right now," or I'm fearful of doing my self assessments of myself because I don't ever want to find something. But what was the emotion? And so, what was that emotional roller coaster for you when you received this information?
You know, I when I was given the news, I remember just like taking a snapshot in my mind. I had just gotten out of jury duty, and I was waiting for the phone call all day long. And I was driving into no, I was walking into the parking garage, and the phone call came in, and she was like, I guess this is going to be really rough for you. And I was like, wait a second, what? I mean, this is how she kind of led into telling me that I had cancer. And
Mhm.
I sat down on the brick wall there, and I just sort of, I don't even remember how I got to the car. I have
Right,
no idea how I got to the car. It just
right.
was just this moment in my head. Everything just stopped, like, how am I going to tell people, or what am I supposed to feel right now? You know, do I go about my business? Do I go do the next thing that I would normally do?
Right.
It was jolting.
And I'm sure it was. And how and we discussed it before. I mean, explaining that support with your family. How did you maneuver within that, especially being a woman, you're a mother, you're a wife, and you're a business owner. How did you maneuver with wearing so many hats at that time?
It was difficult, but I'm very blessed that I have a husband that works from home, and he is very invested in our children and me as well, because he was able to get my daughter ready for school every morning and make sure that they had meals. And then I had friends just come out of the woodwork. Anybody who had had an encounter with someone with cancer or someone that dear in their life that they lost loved ones, they came from hours away just to bring me trays of food or flowers or whatever. And then um, yeah, the support was just kind of unfathomable. I mean, that's like from the outside, from what people could understand, and from that's how they would share with me, is from their previous experiences. But still, as a cancer patient, you kind of don't even know what you need, in that time. Um,
Right.
but yeah, I did feel support from the community. And then I was running a salon in New York City and a salon in South Carolina, and I had about 25 employees at the time, and trying to juggle that. But I had a manager that was supportive, that worked for me, and we made it happen. My clients were very supportive too.
Right. And that's so important, especially during that time. Being a business owner, you're like, again, you juggle so many hats, and you're like, I still have to make sure this works, but I still have to take care of me, family. And a lot of times, mom is that tough one, and it definitely takes the toll, because it's like, were you trying to be tough for your children and your family, but besides Karla, or how did you kind
Yeah.
of get through that?
Yeah, initially I was really trying to be strong because I was like, I know I can do this. I know that God's going to be with me, and that there is a purpose for everything. And but I was trying to be really strong, and I was almost micromanaging the situation at home just to make sure that everybody else was okay. And then I realized I can't do that. I shouldn't do that. They are on a journey as well. It
Mm,
wasn't just me on my own. You know?
yeah. And that's something very important that you stated. You said it was a journey, right? This was a journey,
Yeah.
that you didn't know you were going to have to take this journey. And then
Yeah.
along with that, it was a journey of your support, because how you may see it or how you may deal with it is going to be totally different from how someone else would be. And again, they had to go through their own journey while supporting you. So I think that's
Yeah.
really key, specifically if someone is dealing with this. And with the treatments, what type of treatment did you encounter for your situation?
I had chemo and radiation, and I had a double reduction and reconstruction at the same time as them removing the cancer. So over the course of a year, I had probably 8 surgeries, just in preparation for the treatments. I had to have a port put in so that the chemo could be put into my arteries without having to go into an artery every single time. It would just, that
Mhm.
port was already in the artery, and they would just pop it in there, and I would sit for 3 hours and get the infusions. But it started, it was every 3 weeks, and the treatment would really start 2 days before I'd even go in for the chemo. I'd have 2 days of steroids that I would have to take just to prepare me, to keep me from, you know, getting the nausea and everything. So they're really good at that side of things now, trying to make you more comfortable while you're going through the process. And then
Right.
I'd go through the 3 hours at the hospital, and then come home and have 2 more days of steroids just to kind of keep everything even
Love that.
keeled. And then
Mhm.
they would give you immune support, a shot to keep your white blood cell count up so that you wouldn't catch infection. So there's a lot of medications involved, and it
Right.
was it was tricky.
I'm
Each time they
sure.
gave you chemo, it would get stronger and more difficult to bear. But I just tried to slow down and sleep when I could, and take the
Mhm.
support. That was hard, just to take the support from people, but it was welcome. But it's hard to you know give
Right.
up as a mom.
I'm sure. And you said that you went from the chemo, and then you said you ended up having a reduction and then a reconstruction. Um, so what are some, after having that process, dealing with the reconstruction? How were you? Because I know, just me dealing with other women, when there's been a change and it may not be the full change of their natural body, dealing with the psychological, the emotional component. How was that with the reconstruction?
Well, after the first surgery, when they had taken the cancer out of the one side, they had only operated on one side at that time. And I was so swollen after the surgery that it didn't even look like they had taken anything out.
Right.
But then, after it settled down, I remember just being in the grocery store and looking down, and I had one breast, and it was just that I just stopped cold in my tracks. It was just another jolting moment. But then, um, yeah, the reconstruction and the surgeries were difficult. I had to stay, in bed, but I also had to keep moving, and there was a lot of pain involved. But I ended up getting some physical therapy to help me get my range of motion back, and
Mhm.
that was it was life changing for me because you get stiff, the stitches are
Mhm.
holding you tight, everything's kind of constricted, and your movements aren't as broad. So I had that kind of support as well.
And how did you know? So, what were some functional things that you noticed that you realized, like, hey, I need physical therapy for? What were something? Was it just I'm stiff, or I couldn't wash my hair? Because especially with you being a doing hair
Hairstylist.
hairstylist, I was like cosmetologist, didn't know which word I should be using.
Yeah,
But
that's fine.
okay, so what were some things that you noticed that she's like, hey, I need some extra steps with the support of this recovery?
Well, it was painful because the movement was restricted. So if I tried to reach up for a jar or something in the cabinet or whatever, I wasn't able to go high enough. And I noticed that the range of motion in my shoulder was limited, and
Mhm.
not just this area. Just I guess
Right.
from every I don't know. I'm sure you could explain it better than me, but it was almost like I had a frozen shoulder. So that was a real sign that I needed to get some help.
And that's very common. That's very common. Again, women will say, hey, I just feel like my arm is stiff, it's too heavy. You're trying to force it into a position and it won't go. Then you end up having some impingement pain, pain in the shoulder. So again, just normal things like you may forget, oh, let me reach behind the car seat, or let me reach over in the
Yeah.
cabinet, and you start realizing you can't. And that's something an important piece. It's not a piece that needs to be, you know, uh, checked out at the beginning. But if you're someone who is listening to Karla's story, knowing that, hey, there were so many beginnings until the end. It was getting assessed to say, hey, you know what, there's something that's not quite right.
Yeah.
Then she went through the whole medical component to make sure that she was stable. And then once then it's the recovery. Sometimes the recovery, and I'm not in your shoes, or we're in your shoes because you're not there anymore. But was the recovery actually harder than the process, or was the process harder than the recovery, or were they both equally just about the same?
It's like a marathon versus a sprint. They're both hard, when you're in it's a little bit of both too, though, because when you're in the chemo, you know, it goes over a period of several months, so that's the marathon side of it. But there are really intense moments in chemo where you've got to be able to get through that hurdle, But the recovery, I'm still recovering. I still have, if I'm not careful, I'll slip back into the shoulder stiffness, which is what I'm dealing with right now. But there was a time when I started getting like sciatica, just again from not having the right amount of movement, and the muscles had atrophied, so I wasn't able to stand with support. And I got physical therapy, and so I've gone through several different times of it, but this time was kind of funny because I went through all the therapy and they give you the assessment at the end, and I was like, what's different is I can actually put my underwear on and stand on one leg and not have to sit on the bed. I was like, oh my gosh, what was I, like 48 years old, and I was struggling to
Mhm.
put on
Right.
underwear one leg at a time.
Right. But it's that balance component, right?
Yeah,
And
I
some
didn't have the
people need.
strength because some of the medications attacked my muscles, and so I had like body wide muscle spasms that was like having a seizure. It was really crazy. I wasn't able to tolerate some of the medications, and so now I still deal with muscle issues. So I have to. It's a constant battle to keep watching and making sure that I'm getting support from medical professionals and wellness practitioners.
Gotcha. And like I said, it's just nobody. We don't take for granted what we can and can't do, but we don't realize how much just moving a finger, how important that is when it's not there, and how that one piece of movement or that one piece of stability can be a domino effect of everything else. So, and if you don't mind sharing with us, so you said that you're still going through recovery. So after you went through the chemo and the different components that you went through for yourself, how long are we post treatment for you?
I'm about 2.5 years since the last treatment, which would have been radiation.
Hmm.
Um, yeah, 2.5 years.
Okay. So about 2.5 years, and you're still recovering from some things from the
Yeah, I
physical.
mean that's kind of the way I see it. I
Yeah.
imagine it might be a different story for each survivor, but I
Right.
just feel like it's an ongoing um, it's something that you need to focus on a regular basis. Just like anyone who's healthy, they want to exercise on a regular basis. So you want to. I just want to get caught up, get feeling strong again, and then I can work on the preventative things because right now I'm still just trying to mend different parts of my
Right.
body.
Right. And it's not just it's your body, but it's also the mind component, the emotional
Yeah,
component. Because you went, like you said, it wasn't just a marathon. It was a marathon and a sprint. I couldn't imagine doing a marathon and sprinting at the same time, right?
yeah.
So, but
And there's a trauma factor to it,
right, right.
and that's very emotional. And so yeah, that makes it tricky too. And I wasn't able to tolerate the tamoxifen that you're supposed to take after chemo for 5 years to keep the cancer from coming back. I couldn't tolerate that either because of the pain. But um, technically, you're supposed to be cancer free when you're done from all the treatments. But the tamoxifen is just more of a like an insurance policy, you know?
Gotcha, gotcha. And there's something you hit on at the same time. You said it was some of that the mental component, and I'm an advocate of just being. It's okay to say I'm not okay. It's
Yeah,
okay because that with that whole mental health awareness, that doesn't mean someone's crazy. It's just you needing some help to get to where you need to be or where your goal would be. So, to any woman that would it be safe to say, like, hey, if you're battling something like this, there's nothing wrong with getting some extra help
yeah.
for you.
Yeah, because when I was going through chemo, I had some days where I was feeling really, really sick, and I just thought, well, wow, chemo really sucks. And I mentioned it when I went in for my next treatment, and she was like, really? You need to tell. This is one of the nurses that was administering the chemo, and she's like, you need to tell us these things because we can help you. And I had no idea. I just thought it was something I was just going to have to suffer through. So
Mm-hmm.
you don't know what you don't know, but that's why I'm
Right.
sharing this now because if I have other friends who have gone through chemo, and I'm like, you don't have to feel that way. You may not ever feel great, but do reach out. Don't think that you're crazy because everybody's going to respond differently to the drugs. And if the doctors don't know that, they can't taper it off. They can't adjust it. You just have to advocate for yourself because they want to help you. I was feeling nauseous one time when I was getting my treatment, and I said, "Oh, I feel nauseous," and they jumped as fast as they could to help me.
Wow.
They have little teenage volunteers that were coming in bringing around cookies, and at Roper they treated me like a queen. It was phenomenal.
Good. And it sounds, and I'm glad you got the care that you needed and the care that you would desire, getting what you need in the midst of all this. And it also points out too, a closed mouth doesn't get fed. So if you don't say anything, no one's able to read your mind. But you don't have to realize that person or that woman, or if you're listening to you, you may be a woman, but you're not the only one that has. Everybody's journey and story is different, but you're not the first to go through this. So if
Right.
something's not right, just ask, and either
Mhm.
they'll say, hey, this is normal, or no, this isn't normal, let's help. So if you could give some words of advice or some wisdom when it comes to maybe the beginning, middle, and end. So at the beginning, when you were first found out about being diagnosed with cancer, what would you tell that woman who's looking at it, who is going through exactly what you're going through at this point in time, at that point in time?
Um, I think it's good to be informed, and it's the internet can be helpful in that way, but can also be risky, and it can kind of overwhelm your mind. So I would just advise that if you are reading something, ask the doctor if it's a reputable site for information and get your information from your doctor. But I also found an app called Calm, and you can listen to water sounds. You can listen to I don't know, stories or music to calm yourself. But there were many nights where my thoughts just took over, and I really needed something just to sort of take me out of that, to get me to sleep, because sleep is a really, really big factor in the healing and just feeling sane and grounded.
Good. That's a good tip for someone. That's really because like you said, sometimes it's at the during the night it's where you kind of your mind starts to wander a little bit and you
Because
need that.
you're conditioned to fix things, just as a
Yeah.
human being. You're not intended to be broken, and you want to do everything you can to make it right, and you want to understand everything. But at a certain point you just have to give in,
Right.
and then
Right.
allow yourself to disconnect in some way. But sometimes it's more of a mechanical way. Like sometimes you do have to interject something in, like the sounds and the calming things.
Gotcha. That's like I said. That's a good tip. It's a good tip. What about during this? If you're talking to that woman who's listening at this point, and she is going through now the treatment component, what would you say about that? What would you give her? What couple words would you
Yeah,
say about
yeah, definitely. At one point I finally, I don't know that I hadn't accepted it yet, but at one point I realized that I needed to kind of just give in to the process. And I remember the first time that I thought that I had done that, I was like, all right, I'm on this roller coaster, put my hands on mentally on the bar. And I was like, let's do this. And I was kind of like jerking around in what was happening with my treatment. And then one day I woke up and I was like, you know, I want to have a cup of coffee. That would make me really happy today. And then I thought, well, how can I be happy right now in the midst of all of this? What is a cup of coffee going to do? But it didn't matter. And in that moment, I was like, okay, I was waiting for another call to come in to find out if I was going to have chemo and what the next plans were. But each day I was waiting for another call to come in, and I was letting my days be determined by my diagnosis,
that?
and so in that moment, I was like, you know what? I need to get on this roller coaster, but I need to get in the front row or the back row and throw my hands up in the air and say, woo, let's do this, because it's not the drunk driver that gets beat up because he's all loosey goosey, but it's the person who's hanging on and holding on so tight that gets battered and bruised. And if you're just trying to hold on so intensely to everything and not letting it fall in place, it's really, really painful.
Wow. That analogy or that example, Karla, is pretty that it speaks volumes, to say, and I think that could go for when it deals with the breast cancer journey, but just a lot of things sometimes in life. I mean, I really kind of hit me a
Yeah.
little bit to my left side of my chest and my heart a little bit. It's just kind of going through this process. And again, the drunk driver is the one that is okay, but a lot of ones, the one that's holding on for dear life is the one that's getting beat up the most. So, kind of throwing your hands and letting yourself go through the process. I think that's a really really good example.
It's like a
And so,
trust fall.
huh?
It's like a trust fall.
Right. Like, like if I turn around, like I'm gonna catch you. You promise you're gonna catch me? Yeah, I'm gonna catch you.
Yeah.
But you're
Yeah.
good the whole way. And I think too, not just you. And again, you're not on this journey by yourself. You're having that support, that team along your way. So they're also riding this roller coaster, with you, with their hands up, semi up
Yeah.
in the air. So what
Yeah.
about if you're talking to that woman? So now we've gone through the treatment component. What if it's after the treatment, it's the recovery? So just speaking with her. So you said it's been about 2 years. As you're continuing to be on this journey, this recovery of breast cancer and being a survivor, what would you tell her if she's speaking and she's at this moment now?
I would say be kind to yourself and be gentle and give yourself grace, because at many points of the journey, I just kept going and going and going. And I remember one day when I went to fill the tank up with gas at the gas station, and I was just kind of delirious and got in the car and I drove off with the thing still plugged into my car. And it was just such a panic moment. And I ran into the gas station and I was like, the thing, it's like stuck in my car. And they were like, oh, you're fine. And they're like, you can go. And I was like, I don't have to cry. And they're like, no, you're fine. It happens all the time, and I left, but I probably should have gone home in that moment, but I didn't. And so many times I just thought, I have to do this. I have to be strong. And no, you don't. Some days you can just lay down in your bed, or let somebody give you a pedicure or gift you a massage or whatever, but also be kind to yourself, and don't beat yourself up when you're having a rough day. And sometimes you'll have a rough season, a whole season, and it's okay.
Right. So, and I think you also said be kind to yourself, but I want to also pull in the fact that you said sometimes there are people who are out there who are trying to help you, and also to receiving that, receiving
Yeah.
those blessings. Because a lot of times, I know, like me, sometimes like, no, I got it, I got it, I got it. But yeah, you may have it, but it's okay to receive, because that takes the
Yeah.
burden off of maybe some other people in your support network, and it also allows that person to feel like they are contributing and being a part of
Yes.
that team
Yeah.
Karla, or that team whomever.
Yeah.
Them helping is a way to be a blessing as well. So I think just being kind and also receiving. It's okay to
Yeah.
receive, specifically, especially as women, we're big time givers,
Yeah.
and it's hard for us to kind of put ourselves down and just roll with it. But I think your story speaks a lot, and I want to touch on that component as a business owner, because that's a whole nother extra um, leap into what you're doing. How did you, when your business is your baby, it's a lot. How did you do with that?
It was a difficult navigation. I had so many business decisions to make, and I wasn't clear-headed. That you're so overwhelmed to begin with, and you have people depending on you for their livelihoods, and they've got families to feed, and it was really difficult. I would say that there was a lot of prayer, and I reached out to people who I trusted with the decisions that I had to make. And I mean, there were times when I remember one moment where I was like praying, okay, God, you're going to have to, like, do I have to close this business, or what do I need to do? And it was pretty new business. I had only had it for close to 3 years, and I was still building it. And
Mm-hmm.
and he was like, okay, you're done. And I was like, but I like this. And he was like, you're done. And it shortly after that, somebody sent me a picture of a little girl with a tiny teddy bear in her hands, and like God is there saying, give me your teddy bear. And she's like, no. And then you see in the scene that God has this giant teddy bear in the background, like, but I have so much more to give you. So I had to let go of some things and get on this journey and do this thing. And now I'm in a better place. It's very, very, very different. I am in a studio suite now, working solo, no team, nothing. But I've been given some freedom that I hadn't allowed myself to have before, when I was always mentoring and teaching and pouring into other people. And now I've had a chance to kind of pour back into myself. Um,
Mm-hmm. So
so
it's
it's
almost
it's
like,
different, but just again, let the process happen.
so you would never put yourself in this position where you are currently, but again, your
Yeah,
journey has taken you to this route.
yeah.
So it has been some blessings along the way,
Hmm.
in the midst of. So tell us a little bit. So just if you could tell us a little bit about in reference to your company. What's your name, your business? Where are you located at? How can they reach you?
I'm at Karla Jean Studio, and I just moved to the Salon Suites on 61 in West Ashley. And yeah, I'm your local hairstylist. I do men's hair and women's hair. But one of the things that I've been focusing on since I transitioned to the studio suite is that I want to free up some of my time so that I can start focusing on helping women who are going through cancer treatments now. A lot of my friends have reached out to me to help them, and I've done as much as just shaving off their hair to get them prepared for chemo. Or one of my friends, we collected money and put it together for a donation for a wig, and people actually donated hair for that wig, and we sent it off and had a beautiful natural wig made for her. And so I want to be there on different parts of the journey, but wherever I'm needed. And I feel like I'm a deeply compassionate person. And since I've been on the journey, I feel like I can be a good companion for women. And when they come into my studio, it's more than just, it's not sad. It's very interesting. It's very non-clinical, non-hospital like, but they come in and I spoil them. Cappuccinos and lavender eye pillows when we're washing their hair, and companionship and an unrushed atmosphere and the privacy of my studio. And I just want to be a shoulder, or yeah, but in a happy way. I had a lady come and she said to me, she'd been following me on Instagram for 5 years, and she was finally diagnosed with cancer herself. And she says, you know what? I decided I need to live. And so I went out and bought myself some new dishes, and I came to see you. At first I went home and I told my family, and I was like, and she came to see me, you know. But if I can be that to somebody, if I can be a light and a joy to help them on their journey, you know, that's where it's all at.
And nobody else can, I can speak, bring awareness, do things like this, have series so other women can see their story, or if there's a man who's watching this and there's some female important in their lives that they can also pass the information on to. But nobody's going to be able to reach that woman unless you actually walk that journey. And so, again, thank you, Karla, so much for joining us. We put the information in the chat for Karla Jean Studios, your website where you can be reached. And if you could let us know, kind of, you said Instagram. What is your handle on that?
I'm on Instagram as Karla Jean Studio, and it's Karla with a K. And I'm on Facebook as Karla Jean Studio as well.
Okay. All right. Well, there we have it. And then also too, we thank you so much. And if anyone is, if you're in the, and she said West Ashley. So West Ashley is in the Charleston, South Carolina area. So if you're, just to kind of clarify for anyone who's looking for a new stylist, and if you're looking for someone who you can sit in that chair, who's been through that journey for as yourself, there's a connection. That's a connection that a lot of women won't have, that you will have, and be able to be relatable with that young lady who's in the chair. And if you're needing physical therapy services, if you're like some of the things that Karla mentioned, being able to not lift or do certain things, having some pain, limited range of motion with your shoulders, which is very common after having procedures when it comes to the treatment component after as the journey of your breast cancer surviving healing process. If you're needing physical therapy for that, I am a pelvic physical therapist, and I'm also I'm a physical therapist located at Renewal Rehabilitation Center. You can follow us on in our social media handles as well. But Renewal Rehabilitation Center located in Somerville, and in the Somerville, Charleston, St. George location of Somerville, South Carolina. So, Karla, thank you so much for your transparency, because you don't know, it's just that one woman that you may have brought some light to. You've also told your story about not having what is typical, an indentation versus a lump versus a leakage. So we've talked about the different ways, the signs that you may see if you're having something. But what I want every woman to know, do your monthly assessments. We put on the lipsticks, we put on the makeup, we get the hair did, we're looking good like Karla, right? But we need to make sure we take care of her, the tatas. We need to take care of her, assess, just like you see how you are. Make sure you assess her. You should know your body more than anyone else. And if you're not aware of any changes, how can you be proactive like Karla was? How do you become proactive? But to be proactive, you've got to be active. Again, let's run that by. To be proactive, you have to be active. So make sure you're assessing your whole breast, even looking under your armpit, checking those areas. And if there's something that is not normal, or it does not look like the other breast, or it's something you've heard that you're having that nobody else is having, get it checked out. Don't be fearful. It's okay to be afraid, but don't be fearful, because that one step, a month, a year, whatever, can be a whole challenge, a whole change in your quality of life in the future. So again, I would love, and I would like to thank Karla again from Karla Jean Studios, for coming in and sharing her story and being transparent, so she can help women like I am live their best life below the skirt and also above the skirt. So
Thank you
we
so
thank
much,
y'all.
Tamara.
Thank you, Karla. All right, and you have a good evening. And if you missed this video, definitely catch the replay. We hope you have a good evening.